I would now like to introduce Dr. Amy Chan. Dr. Chan is a physical therapy clinical specialist in the Movement Disorder Clinic at the Cleveland Clinic Foundation. She completed her baccalaureate degree from Case Western Reserve University and received her physical therapy degree from Cleveland State University. In 2011, she became a board-certified clinical specialist in neurologic physical therapy by the American Board of Physical Therapy Specialties. She received her advanced degree in Doctor of Physical Therapy in 2017 from the Neuro Recovery Training Institute. She is a Parkinson's Wellness Recovery and LSVT BIG certified clinician. She is also a graduate of the first physiotherapy summer school for people with Parkinson's disease, sponsored by the Movement Disorder Society. She has completed research on the effect of dancing and drumming on people with Parkinson's disease and Parkinson-specific outcome measures. She leads a community-based Parkinson-specific exercise class and is a guest lecturer for the physical therapy program at Cleveland State University. Her areas of expertise include evidence-based rehabilitation and early physical therapy intervention for people with Parkinson's disease. Amy is a much sought-after therapist at the Cleveland Clinic, and I have no doubt you will find her talk to be full of valuable information. Welcome, Dr. Amy Chan.
Good morning. Thank you for spending the time with us this morning. I hope that you have gathered a lot of good information from the previous presentation. My name is Amy Chan. I'm a physical therapist working in the Mellon Center in the main campus of Cleveland Clinic. I work in an outpatient multidisciplinary clinic that focus on early intervention on people with Parkinson's disease. So since you've been sitting in front of the computer after the last few presentations, why don't we start with some good stretching to loosen up the muscle and get your attention back. So you can follow what I do. Okay, let's start with tucking your chin in, sitting up in a very nice tall posture. Okay, let's reach up to the ceiling, back down, other side, reach up high, back down. Let's stretch out your arm. Come to one side and twist your body back open. Try the other side and back open. So trying to keep this nice posture. Tip your head to the side, to the other side, twist and twist to the other side and look. Roll your shoulder blade back. All right, I hope we get a chance to reset and we'll get to talk to you about fall prevention and home safety in people with Parkinson's disease. Here are some of our objectives. We'll talk about why people with Parkinson are at increased risk for fall. Look at some of the newest benefit of exercise in preventing fall and improving balance. What are some of the strategy you can use at home to reduce the risk for fall? So Parkinson's disease is the second most common neurodegenerative disorder. It's a chronic progressive disease that affects the basal ganglia. We don't have enough dopamine cells. And when you don't have enough dopamine producing cells, you can have motor and non-motor symptoms as a result of that. So currently, if you have Parkinson, people can live really well and have quality of life. These are the two things you can do to prevent the progression of Parkinson. So do Parkinson-specific exercise and be optimal on your medication. We know that people with Parkinson can live with quality. The biggest problem is some of these secondary issues that is caused by immobility, such as an infection, like pneumonia or UTI, blood clots, and complication from falling, okay, such as fracturing the hip. So we know that people with Parkinson are more likely to fall compared to their peers. They're 2 times more likely to fall. And if they have a fall, they're more likely to have recurrent falls. One of the motor symptoms that you see from the lack of dopamine is postural instability. So change in posture and change in balance. And unfortunately, these changes are less responsive to dopamine replacement medication. We know that people with Parkinson are more fearful for falling. And study has shown that if you have more fear for fall, you're more likely to have a fall. The fall usually occurred in your own environment in the house. It usually happens when you change positions suddenly, such as getting up from the chair, when you're turning quickly, when you are bending forward to pick up something from the floor, or when you're multitasking, like carrying something in the kitchen and walking. And a lot of time the falls will happen at night. Some of the motor symptoms from Parkinson makes it harder for people with Parkinson to keep balance. One of them is stiffness or rigidity. The stiffness happen in the spine, in your back. A lot of time your posture is affected. They can have a stoop forward posture. It makes it more likely for them to lose balance forward. Another motor symptoms in people with Parkinson is slowness of movement, bradykinesia. You can see a change in the walking pattern. So a shuffling gait is a walk that with small shuffle step, you can increase the risk for tripping. Fascination is a kind of change in walking where the walking speed start to pick up, but the steps become smaller and smaller. Sometimes it's described as a runaway train, and they have a hard time stopping until they hit a wall, and sometimes they might fall forward onto the knees. Another walking problem we can see is freezing of gait. Feels like the individual feels like their feet are stuck to the floor. They might have difficulty initiating, getting going with the movement, and you might see difficulty with turning. Another motor symptoms you'll see from Parkinson is a decrease in posture control. So the basal ganglia, where the dopamine cells are stored, control automatic movement. Think of it as your autopilot. To have good balance reflexes and balance reaction, a complex set of movement usually occurred without thinking about it. So in individual with Parkinson, these reflexes are delayed. People with Parkinson also rely heavily on their vision. They can have visual changes like double vision or blurry vision. You might see a change in their depth perception. They have trouble with contrast sensitivity, so difficulty judging space, judging obstacles around, going down a step might throw them off balance. So besides some of the motor problem, you will also see some of the non-motor symptoms increasing the fall risk in people with Parkinson. And one of them is orthostatic hypotension. What that means is when a person with Parkinson change position, such as from sitting to standing, their blood pressure will drop. They will feel symptoms of lightheadedness. They might feel faint, dizziness, weakness, might be confused, and it might affect their vision. There are many things you can do to help with orthostatic hypotension. The number one thing is drinking enough water. You know, the majority of our individuals with Parkinson's disease do not drink enough water because of bathroom and urinary frequency, right? So drinking enough water will help. 8 to 10 glasses of water early on during the day. Instead of waiting too late in the day to drink the water when you have to get up in the bath to go to the bathroom at night. Standing up slowly. Pause after you stand up before you start walking. All right. Other things you can do to help with this low blood pressure issue can be using compression stocking and abdominal binder. Talking to your doctors about medication might also be helpful in this situation. So I mentioned earlier about urinary urgency and incontinence, right? A lot of time the falls can happen at night when people are in a hurry to go to the bathroom, right? And sometimes constipation is an issue. If you're straining, your heart rate can increase and your blood pressure can increase, and people can have lightheadedness and dizziness from that. Fatigue is an issue. Fatigue is a very common problem that we see in Parkinson. And when you are fatigued, it's harder to think about good movement, okay? And it's harder to concentrate. People with Parkinson can also have what we call REM sleep behavior disorder, where they are having vivid dreams. They're acting out on their vivid dreams. One story I can share is this client is having a dream of a bear attacking him, and he actually rolled out of the bed accidentally and hurt himself and had to have surgery to fix it. So if you notice any of these symptoms, make sure you talk to your neurologist about options to help with the REM sleep behavior issue. Other non-motor symptoms you will see that will increase the risk of fall are cognitive limitation, right? People with Parkinson can have executive function issue where their judgment is impaired. It's really hard for them to focus and put their attention in more than one thing. So they're easily distracted. So we talked about how the autopilot of movement is impaired. For someone with Parkinson to try to think about good movement all the time is not the easiest thing to do. People can have hallucination, both visual and auditory type of hallucination, and sometimes they can act out on that. Anxiety, your emotional well-being. So people that have freezing of gaits, we know that that is closely associated with increased anxiety. And the more anxious you are, it makes the freezing of gaits worse. So we know that fall and balance can be a major issue for people with Parkinson's disease. There is many different causes. It's a multifactorial issue. I think the best strategy is prevention. Start early. Do not wait until you have a fall to start making changes. So taking action early is the key. It takes a team to help with this situation. Talk to your physician team about medications. Polypharmacy, so taking multiple medication. We know that people that are taking more than 4 medication can have increased risk for fall. Some of the medication have side effects like dizziness and sedation, right? Talk to your movement disorder neurologist about optimizing your Parkinson medication. People that can have motor fluctuation on and off issue with their Parkinson medication, make sure that you're doing everything in your power to optimize the medication schedule or the type of medication. When people are in their off period, they can experience worsening Parkinson's symptoms like bradykinesia. And sometimes the side effect of this kinesia, the involuntary movement, can affect people's balance. Talk to the doctor about management of the low blood pressure, orthostatic hypotension, urinary urgency at night, your sleep schedule. If you get a good night's sleep where your body can recover and repair itself, the next day you'll be less fatigued. Other high-risk situations like osteoporosis, managing that to prevent fracture, and looking at emotional health management. I think it's important for everyone with Parkinson to get to know a physical and occupational therapist that know about Parkinson. So initiating a physical or occupational therapist consult earlier, so you can determine what the baseline functional status is. We look at your strength, your balance, your walking, your daily function in detail. So don't wait until you have the first fall to go to the therapist. So we can help you identify what kind of situation is making the fall happen. Can we modify that? Exercise. We know a lot of the research is suggesting if you have Parkinson, you want to increase your activity. You want to maintain it by doing a good Parkinson-specific exercise program. You want to work on prevention and balance training. And the therapist can also help you look at different assisted devices, like can a walker be helpful to prevent fall? Can you add any grab bars or bedside commodes or tub bench in the bathroom to make the environment safer? So we know that exercise is medicine. There is a lot of research that suggests the benefit of Parkinson-specific aerobic exercise can improve all of these components in your life. We know that it goes beyond the motor symptoms. Some of these non-motor symptoms, such as depression, cognitive function, sleep, and fatigue, can be also improved by doing good exercise. More dopamine may be available in the system with good exercise. The evidence are telling us that exercise has the potential to modify the disease course. Exercise can have a neuroprotective benefits, and the brain has the ability to change in a concept called neuroplasticity. So by taking the right medication to help with symptoms and sustaining a good exercise program, that's the best course to prevent Parkinson from getting worse. And it goes beyond exercise. There is many other options, such as these group exercise classes with Tai Chi, boxing, yoga, tango dancing, can help improve balance. So as a care partner, what else can you do to help the individual with Parkinson when they're having walking problem? So someone was shuffling steps, think about lengthening their stride, take a big step, keeping their base about shoulder width apart will help with balance. Someone with fascinating gait, when they are starting to speed up like the runaway train, a lot of time, the best thing to do is to stop and just reset. Reset with a good posture, and then you restart the movement with a big step. People with freezing of gaits, using different kind of cueing can help. So a visual cue can be when you are stepping through the doorway. Think about an imaginary line and you want to take a big step over it. Counting the step to start. Clapping, tapping might also help you initiate a movement better. A lot of time I notice clients with Parkinson usually lose their balance when they're turning. They turn with a crossover step. If they turn with a quick pivot turn, it will be hard for them to maintain balance. So thinking about turn, think about marching with a big step will help with the turns. We talked about multitasking, right? Turning your head and walking at the same time. So you might want to stop and look before you change direction. So other things you can do to modify your home and your environment to increase the safety, such as having adequate lighting. We talk about how people with Parkinson relied heavily on their vision. So at night, having good lighting in the path to go to the bathroom is important. Sitting in chair with armrest with the proper height will help improve their ability to get up and down safely from the chair. Minimizing obstacle and clutter, taking away and making sure you secure any throw rocks, right? We talk about people with visual problem. When you have carpet or tile with different pattern, it can be a challenge. On the stairs, installing handrail. People with visual perceptual difference, marking the edge of the step with a tape might help. Fixing any loose or uneven step, right? Having good lighting, and be careful with multitasking. People with Parkinson usually do quite well, especially with freezing of gait symptoms on the stairs. They get into more trouble when they are multitasking, such as carrying multiple things in their hand, a laundry basket up and down the steps. Okay, so focusing on the stairs will be safer for them. And in the bathroom, using non-skid rubber mats, a top chair, good grab bar, and a higher toilet seat. And couple other options in different location of the house, okay? Having good lighting in the bedroom. Having a bed rail for that one client that rolled out of the bed during one of his vivid dream, he put up a bed rail and he's a lot safer now. Or you might even consider, a lot of time people will have issue moving about at night and during their off medication time. Right? So having a urinal or using a bedside commode can be beneficial. And in the kitchen, moving the item that you use more frequently to the lower shelves. Really think about, should I be stepping on that step stool to reach up to the top cabinet? Practicing good turns and especially if you have to multitask. The fall usually happen in the kitchen and the bathroom in these confined spaces. So practicing good turn, avoiding stepping backward for a long distance will help decrease some of these high risk situations. So you're doing everything in your power to prevent a fall, but if unfortunately a fall happens, don't panic. First thing you want to do is don't jump right up. Stop and just assess the situation. Make sure you don't have any injury before you make the next movement. The care partner also want to be safe, right, in helping the person with Parkinson transfer back up to standing. You don't want to have injury done to yourself either. So having a good emergency plan. So for hopefully you have practice with the therapist. What is the best way to get up and down from the floor? You hopefully have a plan with a family or neighbor that can help in case you're in this situation, or having a life alert alarm that you can call someone to help. There are a lot of good resources that summarize some of these home safety guidelines. One from the AARP, the Home Fit Guide, and the Parkinson Foundation also have a home safely checklist that you can download. So I hope I can share with you some of the tips to help prevent falling and help improve the home safety in your household. The bottom line is prevention. We know that it takes a team effort. We know that sustaining a regular Parkinson-specific exercise program will make a big difference. We know that getting a physical and occupational therapy consult can help with the exercise and balance training piece, and modifying your home environment. So start early. Don't wait until you had a fall to fix these situations. I appreciate your time. Here's my references. And thank you.